the Saber podcast. I am Ren.
And I'm Lily.
And we are two of the hosts that will be taking over the podcast from here on. I've been on a few episodes, but Lily's new here.
This is my first time. Baby's first
Woot.
pod.
Baby's first pod. We're excited. We wanted to let you know at the top here that we're going to be changing up the format of the podcast a little bit. It's going to be a little more conversational, a little more engaging. If anyone listening has any ideas, feel free to let us know your thoughts and if you hate it and if you would like to hear something different in the future.
But don't be afraid to tell us if you love it as well. We like all sorts of feedback, good and bad, I think.
Love would also be appreciated, yes. But also, or just mild interest is fine.
That's also just anything that makes it more listenable is great.
Whatever you got for us. And you can meet the rest of the team on our socials. We'll be getting much more active there. Instagram and the deceased Twitter platform. I think we still have a thing there. It's at Saber Podcast, SABR Podcast. And you can find us there.
And if you're curious about what we look like, that's where you will also find pictures of our faces.
Yes, so. We exist in real form, in human
material
form, not just waveforms. So yes. Enjoy that, I guess. And now we'll go ahead and get into the introduction for today's guest. Today we have on the pod Dr. Heidi Worabo. Dr. Worabo is a family nurse practitioner and associate professor at UTISCA. She serves as the co-director of the Doctorate of Nursing Practice Program and co-director of the San Antonio Refugee Health Clinic, a free clinic run by the interprofessional team of students and faculty to serve our city's refugee population. She completed her doctoral degree at the University of Missouri-St. Louis in 2012 after conducting a qualitative study on resettled refugees' perceptions of healthcare in the U.S. Dr. Worabo has served as a global health provider and researcher throughout her career, and her work recently focuses on the maternal and reproductive health needs of San Antonio's refugee population.
It's a really cool discussion, and we think you'll enjoy.
So without further ado, we'll go ahead and let her start telling you how she got involved in refugee healthcare.
So I first got interested in that as I was doing my Doctor of Nursing Practice degree at St. Louis, University of Missouri, St. Louis. And I was also working at the time as a nurse practitioner for the Institute for Family Medicine, which is a nonprofit organization whose mission was really to expand access, especially for those who face a lot of barriers to healthcare. So it was very innovative. I would go for like half a day to a domestic violence women's shelter and see patients there, the moms and the kids, really kind of breaking down that transportation barrier, trying to go where they're at, not making them come to us in the clinic. So we also had worked at the county clinics as well. But one of the sites where I was kind of assigned was the Refugee Resettlement Agency. So I was doing their vaccine program. As throughout the resettlement process, they need to make sure they have all their vaccines up to date. And so if they didn't have records, then we would have to kind of give them everything. And so that was my job, to kind of run that for half a day a week as part of my work. And so I just really loved the atmosphere of seeing people from all over the world and just so much kind of hope and at the same time apprehension to starting a new life here in the U.S. And so I think that inspired me. I would love to do my doctoral project here. And so they were very collaborative at the agency and helped kind of set up the study, which was really just wondering, how in the world are they navigating this healthcare system that is so complex, so confusing for even those of us who live here already and were born here. And so that was really what I approached it as. And so really the systematic process of research really helps you understand not only a lot of statistics and things, but also helps you understand people's experience. And so that's really my focus has been the perceptions of people, what their preferences are, what was it like in their home country and the countries that they've traveled through, and then how does that shape how we treat them, right, from a healthcare provider perspective or a health system design, that really tailors to our patient population to work at the best outcomes possible. And so just those kind of questions that come up clinically as you're working with patients is really what has inspired me to continue in research.
Absolutely.
So, as you've heard us mention, and as you've heard her mention a few times, Dr. Worabo is a DNP, which before, having this discussion with her, I didn't have a lot of knowledge about what having a doctorate in nursing practice really entailed.
Right, absolutely. It's kind of a rarer degree, I think. It's catching traction, and it fills a very unique niche in the healthcare scene. So we'll let her tell you a little more about that.
So it's actually a fairly new degree. So I think it started coming out in the early 2000s as a way to kind of fill this gap of there's research and then there's what we do clinically. How can we bridge that gap so that, this great research that's taken so many decades to come up with, find answers, how do we put that in practice? So the DNP for nurses is, focused on implementing that research into clinical practice, which is a whole science of its own, this implementation science and translation of, and so that's the big focus of the DNP. When I went through the DNP, it was in its infancy and it was more research focused because there was no DNP faculty. It was only PhD faculty. So it was a little bit off, but today we've really tried to focus more on the implementing of those best practices and how do you make that change in, whether it's a hospital unit or a clinic or a hospital system to really improve health outcomes using the best science. So the DNP has that focus versus the PhD, which is really, the traditional research and getting a good base at all the different methods and things like that you don't get with the DNP.
Dr. Worabo favors a qualitative approach in her own work. Though there are certainly values to both qualitative and quantitative work, Dr. Worabo appreciates the way that qualitative research enables her to sort of connect and be more personal with patients and elevate the depth of their stories, which I think is very valuable. It was really cool to listen to.
Absolutely. It's so important to know that it's not just numbers in the research field, it's other things as well. So we'll let her speak on that.
I love the qualitative research side where, the participants usually, they can really say, what they're feeling or what they're thinking, and you get their voice rather than a survey or quantitative studies that, they have to choose a box, or get forced into an answer. Whereas these are just open-ended questions, so you really get rich data. But I mean, there's a place for both for sure, but that's mostly been my focus is that conversational interviews or focus groups.
I think a lot of the qualitative research, especially like as student learners, gets overlooked. We hear a lot more from the quantitative, the data, the lab side of things.
Yeah.
I was just wondering if you could maybe discuss a little bit of what the qualitative research process looks like.
Yeah, and certainly that is not my field at all, so I can't say too much about that, but certainly huge value in making big decisions come from, the quantitative piece. But the qualitative, it just gets at a deeper level. I think it really helps to start with that in some instances and then move to, that will lead as a foundation for where we're starting to really test something out then. So I think it's a good baseline to start with in a lot of cases. It's been really good with, a population that, is different culturally or different linguistically, because when you try to form a survey, sometimes the questions come totally wrong than what you intended, especially when it gets translated or just individuals can interpret things differently. So it's nice to kind of leave it open and let them speak at least to kind of gain where you're at initially,
right,
and then using that to make more of a quantitative that could be disseminated wider, because of course qualitative, you can't have too many participants because it takes a long time to analyze.
as mentioned, Dr. Worabo primarily focuses on the health and wellness of refugee populations. Her work in San Antonio has been broad and includes a great body of research on the health outcomes of women from Afghanistan. In our conversation, Dr. Worabo highlighted the many layers of nuance that working with individuals from cultures that we in the US are not as familiar with. She really highlighted the special considerations that need to be taken when working with those groups.
I think just really giving people a voice who, really don't have one. I think that's the most fulfilling thing about it, I would say. Just like, the Afghan women who are really used to not being listened to at all, like they're really not supposed to be talking. And that's how they've been trained and how they, just what they're used to. And so just hearing their stories and seeing their strength and how they care for their families and care for their husbands and, do so much to be admired. But, I think a lot of times they're seen as not like that,
Yeah.
and that they have so much to offer, I think. So I think giving them a voice in what they feel is good, acceptable care, from a healthcare provider is important.
Absolutely.
Absolutely.
I think this was another like pearl of wisdom from one of the papers that I saw was the impact of having like a male presence in the room versus not, and how that impacted the women's like feeling of safety or like ability to talk about their illness or what was bringing them into clinic. And so that like related some way, and like the idea of these women feeling that they have a place to speak and like feel safe culturally or like just safe to do so in general. So yeah, it's really interesting.
One of our favorite things here at the Long School of Medicine for both me and Lily, I believe.
Oh yeah, for sure.
Absolutely, is the student-faculty collaborative practice. And through that, we run three times two.
And 3 times, yes.
We run three
and
times
3 more.
2 and 3 and also 3 more. We run 6 student-led free clinics that are in collaboration with our faculty members and overseen by doctors. And those clinics primarily run by students, but they serve people who may be unhoused or uninsured or otherwise unable to seek care. We have several specialized clinics as well. That includes 2 dermatology clinics. We have the Pride Community Clinic, which serves to supply people with HRT who may not be able to seek it out. And also Alpha Home Clinic, dedicated to helping women from the Bexar County area who are struggling with substance abuse disorder. And also the Refugee Clinic, which Dr. Worabo is primarily a part of. Yeah. And in the Refugee Clinic, there are a lot of students who conduct their own research in all the clinics, really, but Dr. Worabo would tell us a bit more about the students at Refugee Clinic.
Yeah, it really is a great place, the Refugee Clinic, because we've got students and, they're always coming with good ideas. And so that has really spurred, like, how could we make this better? And then at the same time, we're all learning. So,
right. Absolutely. And I know that there's sort of a lot of student-ran research projects that are conducted at the Refugee Clinic. I'd love to hear a little bit about how that kind of works, how med students can get involved, or any health profession students could jump in at the ground level there at the Refugee Clinic.
Yeah, I mean, that has been definitely one of the highlights over the years is, and really supported a lot by the center with the community service learning grants. So I think that's really encouraged for the medical students in particular, but dental, nursing, they're all in there too over the years. But I remember one group, this was several years ago, we did interviews with different groups of refugees at the time who were coming at the time. And it was just great to see, the students be able to interview and just hear the patients' experiences. So, which it's great to have students involved because you see a different side, of the patient when you're asking these other questions and really taking the time to analyze that versus, I got to ask my history questions, I got to do my physical exam, I got to get to a diagnosis. So, yeah, it's a great experience. So I would say volunteering at those clinics really help you meet and then taking on leadership roles, a lot of the student leaders for those clinics are the ones that are doing those projects or organizing them.
Do you have any like particular projects that you've seen students be able to develop, like from like small seed ideas into things that you like to talk about, or they have like particularly, I don't know, impacted or impressed you or in any way?
Yeah, I think definitely just starting small is good, and doing it as a team. I don't know if it's flourished into anything else, but I thought it was really important, and I think we continue to do it at the refugee clinic, is, you know, when you have the language barrier, you have different, cultures, different health literacy levels of patients. There's a lot of miscommunication that can happen. And so when we see patients, they come back and they tell me, oh, I took my blood pressure medicine. I just take it for my headache whenever I have a headache, like, oh no, that's not what we meant when we prescribed this or when we gave this to you. And so one of the students came up with a system that is based on pictures and labels, different color codes for the medicine bottle. This is to be taken at night, and this is to be taken. She kind of came up with these pictures of what, indicate pain or indicate diabetes or indicate blood pressure, and then matched it with the colored code on the medicine bottle. And I think with her project, we had talked with a pharmacist who was interested in actually making, redesigning their labels from an actual pharmacy, that'll be more picture focused and color coded and things like that, rather than just all the words, which you can imagine if you don't read or understand English, that's going to be really hard to take your medicines the right way.
Absolutely.
So that's just one example of a really excellent project, I think, that has gone on at the refugee clinic. That's small, but definitely could be extended, I think, across the pharmacies.
I wasn't even aware, because we learn about using that when you go and volunteer there. I wasn't aware that started as a student project. So that's really cool to learn that you can have such, to me, I think it seems impactful.
Absolutely.
Like you said, obviously for patients who don't speak the language that they're getting healthcare from, but also just for people with like low health literacy in general, which is an issue that we're learning about in school. So
I think I'd like it if my medicine bottles had pictures on them personally.
Really
So,
nice.
I think,
Right.
spreading that would be really nice to make them more legible, easier to understand. That's an interesting project. Yeah.
So, in preparation actually for the conversation that we had today, we obviously found all of the impressive body of research that Dr. Worabo had conducted, but we also came across a really inspirational story about sort of her journey with global health projects. We thought it would be kind of interesting and fun to share with y'all. I'll just let her get into the story, but it gives us insight into the things that inspired her to go into work with refugee populations and participate in global health initiatives, and we just thought it was a cool story to share. So
Yeah, absolutely. It was fascinating. We hope you enjoy.
My grandfather, my mom's dad, and my grandma sailed off on a boat in 1948 from Minnesota to Ethiopia. And my grandfather had been in the Korean War as a young, man, and I guess he was inspired, just being in the Philippines, I want to say. He was stationed there, and he saw the kids, and he's like, oh, I want to go, share the gospel, share the good news with these people here, And so when he got out of the military, that was his dream. And then he was in the Baptist church within the Minnesota conference, and they said, well, we don't have anything in the Philippines, but we have something in Ethiopia. So that's when they went in this is after, I guess, World War II and things. And so it was him and my grandma, and then they had my uncle, who was 2, our baby, something around there when they went. So they were there 2 years in a small town called Ambo, about 2 hours outside of the capital, Addis Ababa. And then he was on a motorcycle with one of the Ethiopian guys helping them, going from one village to another, when a random guy shot him and killed him instantly, and then injured the guy in the back. And so my grandma was pregnant with my mom when that happened. And so they said it was a shifta, which is like a name for a thief or something. And so, it's very quick justice at that time. The farmers and everybody caught the guy. But they're not really, nobody ever knew exactly why he did that. He took his camera and his wallet, I think, but other than that, just kind of really tragic, unexpected for the whole country. And so they were there under the permission of Haile Selassie, who was the emperor at the time of Ethiopia. And so they were very kind to my grandma, and like the princess who was married to the governor of that region, came to the funeral and was crying with my grandma. And it was very interesting that she went back to Minnesota after that. She was pregnant with my mom, and then she had the 2-year-old boy. And so she went back to where my mom was raised in Minnesota. So I just heard very little of that when I was growing up. And then when I went to college, I met my husband, and then we decided to get married. And when I first met him, he's like, "Oh, I'm from Ethiopia." I was like, "Oh, my grandfather was killed there." He's like, "Oh, I'm sorry." But it was very interesting when we got married. Then my grandma, who was still living, she, I don't know, there's a lot of connections in Ethiopia, and so it seems like everybody knows everybody. But my husband we had a friend who knew the princess, actually, who had been to the funeral and everything at that time, 60 years prior. She and her husband were actually in DC, and so they had a phone call, hour-long phone call or something, just reminiscing about that. So it's just very interesting how it kind of came full circle like that. And then more recently, been working with Bridging Ethiopia, which is it's nonprofit, but it's just an organization basically with the mission to bridge the gap in healthcare, IT, and engineering in Ethiopia. Started by Ethiopians, who grew up or have been adults here in the U.S., had education and training, and want to give back, when they go home to visit family and things, like, why don't I do a training or have some sort of connection professionally to help the universities there or help the healthcare system there. So on one of those trips a couple years ago, we went to Ambo because we had a connection to the faculty there. And so we now have a MOU with Ambo University. So we're hoping that we'll have students come eventually too. But yeah, just kind of that full circle.
Wow.
We actually had a lot of pictures that my grandparents had taken while they were there, and they were on little films and things. But found a lot of the buildings where they lived and worked, and so my grandma was a nurse and worked in the clinic there, and so saw the hospital where she worked at. And
that's incredible.
That's
Sweet.
yeah.
That's so interesting.
So at the end of our conversation with Dr. Worabo, we asked if she had any big last parting words, and we liked what she had to say.
Yeah, she had some good advice for students of any kind, or just if you're thinking about these kinds of topics and health topics. We thought she had some good words, so here's those.
I would say take advantage of any global health opportunities. I was able to go to Zambia with some faculty and students last fall,
Oh, wow.
and it was an area really they didn't have much electricity, and so you're really just disconnected for like 2 weeks, and it was really nice.
Oh, wow.
And yeah, I really enjoyed just the people and the peace, and just yeah, I think take advantage of it because you learn so much. And you won't always be able to travel.
Yeah.
Right.
Yeah. I think we can learn a lot through global health to make things better here, as well as learn from refugees here who have experienced so much different. Just thinking of some of the women, we interviewed from Afghanistan, just about their experience with giving birth in Afghanistan versus here, and just the admiration you get from just hearing what they've been through, and then how could we learn some of those good things that they have been doing, such as they breastfeed for all their babies for 2 years without much problem. It's just kind of part of their expectation and what they do. It's like, well, how could we do that, use that to improve our breastfeeding rates here in the U.S.
Sure, yeah.
So,
Well, thank you so much for talking with us today. I think I got a lot out of it. I think that our audience is going to learn a lot and be impacted by our conversation today. So.
Absolutely. And thank you as our first ever DMP on the podcast.
yeah,
It's very exciting.
Thank you for inviting me. And it was really fun talking with you.
Thank you all for tuning into this episode
Thank you.
of the Saber podcast. It's been fun. We'd love to have you back next week if you're so inclined. So be sure to subscribe, leave a review if you enjoyed. And in the meantime, if you have any questions or concerns, you can email us at sabr.podcast.outreach@gmail.com or find us on Instagram at Saber Podcast. Until next time, I've been Ren.
And I've been Lily.
And stay tuned for more inspiring research stories.